Something about the way healthcare works in the United States has stopped sitting right with a lot of people. The premium that keeps climbing every year for coverage that covers less and less. The 10-minute appointment that ends with a prescription and still no real answers. That quiet question so many people have started asking, is this really the only way to do this? Welcome to the Health Over Wealth in the U.S. I'm your host, Suzy Wraines. I want to say the question isn't wrong, and it's a lot more common than the system wants people to think. This podcast exists for one reason, to show that there's another way to get healthcare in America outside the insurance system, as most of us have always known. Cash-based, client-centered practitioners exist in every state across nearly every specialty. Physicians, naturopaths, physical therapists, mental health providers, nutritionists, and more. People who have chosen to build their practice around patient outcomes instead of an insurance company's timeline. They're out there right now across the United States. The problem has never been that they don't exist. It's that they're almost impossible to find. That's what Health Over Wealth in the U.S. is for. Every episode, I'll walk you through what's already been published on Health Over Wealth. Real information from the cash-based practitioners behind it in their own areas of expertise. Think of the wellness questions floating around the internet right now. The ones everyone's Googling but nobody trusts the answer to. What does GLP-1 support actually look like when it's done right? What does hormone optimization actually involve? What does real mental health and wellness support look like? What is energy healing, and does it actually work? How can nature actually be used as medicine? What does cash-based pediatric care look like? What do you do when chronic pain hasn't been solved by the usual approach? If so far what I'm saying resonates with you, go to how.healthcare and subscribe to be updated on the latest articles and podcast episodes. This show is for people who are looking for results, not just a quick visit and a prescription. This is real information from real practitioners who are seeing real patients right now. Every one of them is someone you can actually go find through the Centered Care Directory. From time to time, some of these practitioners will join me directly for a bonus episode. Every episode comes straight from what's real and published. This show is for anyone who's paying money for insurance and not seeing what they'd hoped for in return. For the researchers, people who Google their symptoms, watch a few videos, and want to actually understand their options instead of being handed a decision. Not people looking for someone to tell them what to do. People looking for someone to partner with them in their healthcare. So a little about me. I spent decades in healthcare, combined human and veterinary medicine, and I've been a patient in the VA system. I'm an Army veteran, so I've seen the industry from more angles than most people ever get to. What I kept running into over and over was the same gap. Amazing practitioners who had left the insurance system to actually practice medicine the way they wanted to, and patients who had no idea these practitioners even existed or how to find them. So I built the bridge. It's called the Centered Care Directory, a curated nationwide directory of cash-based and hybrid practitioners across America, reviewed and approved, searchable by location and specialty. Every practitioner listed there has chosen to practice outside the traditional insurance model so patients can come first. When it's time to actually go find someone, that's where the search starts, at how.healthcare. I was told when I was young, and I'm in my 50s now, that it didn't matter what job I got as long as they had good health insurance. Now, the insurance is what's keeping millions of Americans from adequate wellness care. This podcast is here to change that. So this is Health Over Wealth, a show for anyone in America who's ready to stop assuming insurance is the only option and start finding out what else is out there. Coming up, we're getting into the questions people ask the most. What are non-opioid chronic pain options? What hormone optimization actually means? How energy healing and nature-based approaches fit into real treatment? How to stop foot and ankle pain, and more. Straight from the practitioners who do this work every day. If this episode resonated, hit follow or subscribe where you're listening so you don't miss what's coming next. And when you're ready to start exploring your own options, come join the community at how.healthcare.